knowing that all of this knowledge exists and all of these options exist,
Yeah.
and that there are these experts out there who are holders of these techniques, why is it that some women with endometriosis have to undergo multiple surgeries?
Yeah.
Why isn't it caught the first time?
So going step back is the delay in diagnosis as well. On average, it can take up to 7 to 10 years for a woman to even have a diagnosis that their pain is related to endometriosis.
Is that just in Canada, or is that generally accepted
That's
worldwide?
That's worldwide.
Really?
Yeah. And I think that goes back to a lack of advocacy. As you said, women didn't want to talk about their painful periods. But I think as we grow and we communicate more about this topic, people will learn more. So the challenges are patient education, physician education, and advocacy, or general public knowledge. And I think we'll see earlier diagnoses, I hope, being made. And I guess in response to your question of why do women need multiple surgeries, I think we're seeing a change, at least in Canada. We've proven through work done out of Alberta that we're actually doing less surgery now, because the message is out that if you are going to do surgery for endometriosis, that you follow it up with medical treatment and that you try to minimize the number of surgeries. That's been our message from the beginning. Reduce the number of surgeries. And often when I see them, they've already had 2 or 3 surgeries. But over the last 5 years, I'm seeing more and more patients who were being referred for their first surgery. So that's the perfect time for me to catch them, to provide that aggressive type of laparoscopic procedure if they're in a severe case, so I can help them feel better, save their uterus so they can have kids if that's what they want, and make them feel better.
You raise an interesting point, and I know we're almost out of time, but hysterectomy is often prescribed for women who have had endometriosis. And I've spoken with some endometriosis advocates who say that's really not an appropriate treatment because, you know, the endometriosis involves growing tissue outside the uterus. So even if you remove the uterus, that's not going to prevent the disease from growing elsewhere. Is that an accurate depiction?
Holly, this is it's always tough, right? Because at the end of the day, the number one thing to look at is what is the patient's desire and what does the patient want? If she's a 24-year-old woman who wants children and wants to keep her uterus, then we will do everything in our power to deal with the disease without removing those essential organs. And that requires a bit more experience to do. But if a patient is a bit older and has had their children and the disease is invading into the muscle of the uterus, if their life is really debilitating, you would cut out all the endometriosis, and it is very valid and accepted that the uterus can be removed at the same time because there is definite improvement in pain response when you do that. I think what the more important question in those patients who want more what we call definitive therapy, you know, they're tired of suffering and they've been through so much, or they don't want to be on medication, they want surgery, is whether or not we need to take out their ovaries. I think that's the more important question, and I think at the end of the day, I think later in life, I was taught to take out the ovaries.
Were you? And yet you're so young. You've only been practicing for, you know, not as long as some of the Bill Parkers of the world, and yet that's surprising.
Yeah, that's what we were all taught, and for endometriosis especially. But I'll tell you now that we really are trying to spread the message that you can cut out the disease. If a woman wants the uterus removed because that's also a source of her pain, we can do that. We really encourage the ovaries, or at least one ovary, to remain.
Right.
Because bottom line, you're going to live longer. You're going to live a higher quality of life.
Right.
And so we balance that with a risk of recurrence of disease. But back to my final message there is, it depends on what the patient wants. If a patient wants to keep their uterus because they're younger, we support them. And if a patient wants their uterus removed, who's a bit older, who has deep disease eating into the uterus, something called adenomyosis as well, and they want a hysterectomy, I will support them. It's about patient choice, and I don't think anybody should choose for that patient specifically.
That's fabulous. Closing thought. I think as a society, all of us have heard these stories of brain surgeons and cardiologists who are on their feet in the operating room for, 10, 18, 20 hours. I want people to understand the world that you live in.
Yeah.
how long are you on your feet in the OR when you do some of this minimally invasive surgery for these conditions that aren't quote unquote life-threatening? You know, but you're right in there, just like these heart surgeons and brain surgeons. And I want people to know and appreciate what you do for them that involves an equal amount of time.
You know, I think at the end of the day, those of us who do this work will do almost anything for our patients and their well-being. And for us, we do see this as beyond being what we would call a benign disease, because you mentioned it's not life-threatening. But that woman whose life has been turned upside down, who can't go to work, who can't function, it is life-threatening. This has impacted her quality of life, and I will do everything possible to make it better for her that I can. And so the surgeries do take longer, especially when you're trying to save the uterus in a young patient, to work around all those important structures, and especially when it becomes more severe. That skill set, that time, it is required. And so we can do operations that last anywhere from, you know, a couple of hours to 6 or 7 hours. And there are patients who do have life-threatening issues happen. Endometriosis can affect the kidneys, the bowel, to a point where these patients have severe secondary problems. So at the end of the day, we love what we do. We love the benefit to our patients. But I think everybody's got a valid argument for working hard. And for me, my mission, your mission, is to advocate for women and women who suffer from pain and bleeding.
Dr. Singh, how can I ever thank you for your time? You're always so gracious and giving of yourself. And on behalf of all women, I really want to express my sincere thanks to you for everything you do. And I've learned a lot today, and I know women watching have as well. So thank you so much.
It's my pleasure, Holly. Thank you.